My name is Ann Zajac, and I'm a veterinary parasitologist at the Virginia-Maryland Regional College of Veterinary Medicine at Virginia Tech. But today I'm here at Peckham Farm on the campus of the University of Rhode Island in Kingston, Rhode Island, with my colleague, Dr. Catherine Peterson. And we're going to provide you some information on using the FAMACHA system in small ruminant parasite control. Support for this video was provided by a USDA SARE grant and by funding from the College of the Environment and Life Sciences at the University of Rhode Island. I'd like to talk to you now about using the FAMACHA system to score your animals, assess your animals for anemia, and make deworming decisions in a selective deworming program. The FAMACHA system was developed in South Africa and was brought to the United States under the auspices of the American Consortium on Small Ruminant Parasite Control. And more information on this system is available at their website and also at URI's website on small ruminant parasite control. The FAMACHA system is a targeted or selective deworming program that's based on the assessment of anemia caused by Haemonchus contortus, the barber pole worm. And anemia is merely a reduction in the number of red cells in the blood. It works only where Haemonchus contortus, the barber pole worm, is the predominant parasite. Because of the major worm parasites we have in small ruminants, only barber pole worm causes anemia. So in parts of the country where this isn't the dominant parasite, this system is not useful. By measuring anemia in an animal, we're indirectly measuring the burden of Haemonchus, and therefore we can make a deworming decision based on that score. It's always important, though, to look at the whole animal and make your decision based on your assessment of the entire animal. The FAMACHA system requires the use of a card, and you can see in the card, on the card, that there are 5 color categories. You compare the chart, this card, with the color of the mucous membranes of the conjunctiva of sheep or goats. Match the color of the card to those mucous membranes, and then you're scoring the animal from 1 to 5 based on this scoring card. And you can see that number 1 represents the pinkest color. Numbers 1 and 2 would be an animal that is not anemic. And you can see in the little area above those colors on the card, there's a check mark, meaning they don't need deworming. Whereas categories 4 and 5, the paler colors, above the colors on the card, we see an exclamation point for the 4, indicating you better treat it now. And then above the 5, a skull and crossbones, because these animals may often not respond to treatment quickly enough to save their lives. And a number 3 gives you a question mark, and we'll be talking in a moment about whether or not to treat the number 3s. This system of scoring animals was developed after a lot of extensive research, where many hundreds of sheep blood samples were taken, a more accurate measurement of red blood cell level, the packed cell volume or hematocrit, was determined. And then those hematocrits were matched to the colors on the card. And you can see that as animals score in these different categories, it matches very specifically what their red blood cell levels are. When you've scored an animal, you then make your deworming decision based on the score, as I mentioned. And as I said, in categories 1 and 2, we wouldn't deworm the animal because that represents color indicating normal levels of red blood cells. Animals that fall into categories 4 and 5 really need to be dewormed because their levels of red blood cells are well below normal levels. But category 3 is slightly different, and we recommend deworming animals in category 3 under certain circumstances. And as an owner, you need to make your decision about whether or not you want to deworm animals falling in Category 3. We typically recommend deworming those animals in Category 3 if they're very young and especially vulnerable to parasites. We recognize that young animals are very vulnerable, so kids and lambs we would normally recommend treating. We might want to treat animals, adult females that are in late pregnancy or early lactation, because they're under a period of greater metabolic stress than at other times. Animals in poor body condition should probably be dewormed. And if you have any concern at all about the condition of the animal for whatever reason, it is certainly appropriate to treat animals that fall in Category 3. The next issue is, when do you start scoring animals and how often do you do it? And what we'd like to see people do is that when you hit the primary season for transmission of barber pole worm, which is basically going to be when conditions are warm and moist and you have adequate levels of moisture, then you really should use this system every 2 weeks. If you draw it out and only score every 3 to 4 weeks, you can run into a situation where a vulnerable animal like a lamb or a kid can move from a 1 or a 2 to a 4 or 5 very rapidly within that 2-week period. So if you're scoring longer than that, you run the risk of missing seriously affected animals that may die. When you're outside of that peak worm transmission season, it's possible to draw out the period, the interval between scoring animals. And this will be based for each individual on their own experience, their knowledge of their own animals, and is something that can be worked out on each individual farm. Now, if you do find yourself in a situation where more than 10% of the herd or flock is scoring a 4 or 5, we really recommend that you start checking weekly instead of every 2 weeks. And that way you won't run the risk of losing animals in the intervals between treatments. We also suggest in that situation, which indicates a more severe problem, that you do treat the 3s, and that if at all possible you change pastures so that animals can go on to a pasture with fewer parasite larvae. An example of this situation would be a herd of goats, of 20 goats, where you have 15 of them scoring 2 or 3, 4 of them scoring 4, and 1 of them scoring a 5. This would be more than that 10%. You would go ahead and treat the 3s, 4s, and 5s, and then recheck again in a week to see how they're progressing. And as I said, if at all possible, move them to a pasture where the exposure to parasites would be less. Then at the point where you see recovery of animals so that you have fewer than 10% scoring 4 and 5, you go back to checking every 2 weeks for the remainder of that intense transmission season. Now, many people will say, I can't use FAMACHA because I have too many animals. I can't be checking hundreds of animals every 2 weeks. And in fact, we recognize that it can be difficult to manage when you have large numbers of animals, but don't think you can't use this system at all, because what you can do, in fact, is score your most vulnerable animals. If you identify that group of animals that's most likely to be anemic, you score them, they'll be a good sentinel system for the rest of the flock or herd. So if you can score only lambs or kids, if they're not showing more than 10% in categories 4 or 5, you don't need to check the rest of the animals. Many people like to say, well, I'm going to check the last animals that come up to be fed, because those animals are moving slower. They stand a higher chance of being anemic. So it is possible to manipulate this system to fit your different type of operation. You also may wonder if there are not other things that could make the mucous membranes red. And in fact, there are a few things that could occur. You could have a conjunctival infection or inflammation. You could have just irritation from environmental factors. You could have systemic disease that causes inflammation. But really, these things occur pretty uncommonly, so that the red color of the mucous membranes in an animal really does generally indicate the level of barber pole worm in the animal. Conversely, are there other things that could cause anemia and make those mucous membranes pale? And of course, here again, there are possibilities. Animals that have systemic disease, chronic systemic disease, may certainly become anemic. But in areas where barber pole worm is the predominant parasite, in the summer grazing season, by far and away, it is the most common cause of anemia. And you should consider that an anemic animal has hemoncosis until proven otherwise. So you always assume that is the cause, and then if subsequent experience and response to deworming suggests that it might be something else, then you can explore other causes, but assume it's hemoncus first. The card itself should be stored in a dark place when you're not using it, because they will fade. They'll also fade if they go through the washing machine. So you want to take care to store your card appropriately and only take it out and expose it to light when you're actually using it. Some people will get 2 cards, and then that way they can keep one of the cards in a dark place, and the card that's in use can be compared to the card that's being kept in the dark. In the information that's provided with the FAMACHA card, it does say replace after 12 months. I think we've found that if you're careful about protecting your card from light, you can stretch that out to probably 24 months. And replacement cards would be available by contacting the University of Georgia using the email address provided. That the University of Georgia is the only place in the U.S. From which you can obtain cards. You can do that directly. You could also do that through your veterinarian. And just to remind you that training is required initially to obtain that first card. And that training could be through your veterinarian or through attending an organized workshop, often through local extension. But that training is necessary to get your initial card, and then once you've done that, you can contact the University of Georgia directly to obtain replacements. It's extremely important and really valuable to you as a producer to keep herd and individual records. Again, in the packet of information that's provided with the card, there is a template for keeping herd records that you can use. But on the URI Small Ruminant Parasite Control website, we also have forms that can be used for individual record keeping. And we suggest absolutely that you keep individual records because the FAMACHA program provides an excellent way to gather information for use in breeding selection decisions. So let me say quickly how we actually score the animals, what the process is. We'll also be demonstrating this on animals in this video. But just to run through initially the steps involved, you need to identify an area for scoring that's in direct natural light. This means that doing it in the barn really is not appropriate. Doing it under an overhang in a shaded area is not appropriate. You need direct natural light. It doesn't have to be a sunny day You just need that direct light. Now, some owners find it very difficult to examine animals outside. They don't have the setup for handling animals outside, whereas they do have a setup in the barn. And we do feel that it is okay if you have a window in a barn where the light is coming in a direct stream. So you're getting perhaps early morning light or late afternoon light coming in directly. It's okay to move the animals to that spot and score them there. But scoring animals by the light of an incandescent bulb will not give you correct scores, and you'll find that you tend to score animals as more red when you do it in a shaded area or where the light is not good. You always want to use the card. There's a tendency for people to say, oh, I know what those categories are after they've done it a few times, but you really always need to refer back to the card. So we've divided the steps for exposing the membranes and scoring the right area into 4 steps. The first step is to roll the skin of the upper eyelid down over the eyeball and cover the eyeball. So you're covering the eyeball with the skin. The second step is to push down on the eyeball. You're actually putting pressure on the eye. It doesn't hurt the animal. They may shake their head, and if you try it on yourself, it feels a bit funny, but it doesn't really hurt. So you're actually putting a little pressure on the eyeball. Then you're pulling down the lower eyelid, and when you do that, the membranes that you want to score pop into view. So cover, push, pull, pop. If you don't follow these steps, if in fact what you do is just try and pull the upper and lower eyelid away from the eye, all that you'll do is expose the inner membrane of the lower eyelid. And if you try and score the inner membrane of the lower eyelid, you won't get the right score. Those mucous membranes, this rich bed of mucous membranes that actually sits underneath and a bit back in that eye socket, that's going to usually score more intensely red than anywhere else that you can score in the area. So you need to make sure you expose that bed of mucous membranes. It's important to be quick, because as you keep those membranes exposed, they'll get pinker and pinker. So you want to make your decision quickly, confidently, and then you turn the head and repeat the process with the other eye, because the eyes may be different. And we don't want to risk missing an animal that needs treatment. We want to be sure and deworm every animal that needs to be treated. So you score your animal based on the highest number, the greater the opportunity for anemia. So if you have an animal that's a 2 and a 3 on those 2 eyes, you would score it a 3. You're going to treat based on that card score, but always keeping in mind that if there is any other situation with the animal, any other condition in the animal, anything that makes you feel uncomfortable about not treating an animal, it's okay to go ahead and treat. The welfare of your animals is, of course, the greatest concern. Finally, let me summarize the use of the FAMACHA scoring system in 6 major points. Firstly, always do this in direct natural light. Secondly, always use the card. Don't rely on your memory. Thirdly, use our system of scoring the animal: cover, push, pull, and pop. Fourthly, score both eyes. Number 5, be quick. Don't stand there trying to make up your mind for a long time. And number 6, make your treatment decision based on the score unless you have specific reasons not to. The FAMACHA system of selective deworming is an extremely valuable program for small ruminant producers for 2 reasons. Firstly, Drug resistance has become an enormous problem around the world in small ruminants. And the FAMACHA program allows you to deworm the animals that truly need to be dewormed, but not use any drugs unnecessarily, and consequently, we hope, will help preserve the activity of the drugs that we have. Secondly, FAMACHA is an important tool in making selective breeding decisions to increase the amount of parasite resistance or resistance to parasites in any group of sheep or goats. So for both these reasons, we really encourage you to use this system to improve and maintain the health of your animals in situations of parasite challenge. Well, we have a beautiful spring morning to demonstrate to you how to perform FAMACHA scoring on sheep and goats. We're showing you initially, right away, that you want to be in direct natural light. It doesn't have to be a sunny day like today, but it needs to be direct natural light. And you don't want to be in the shade or under an overhang or in the barn. We need full light shining on the animal's face. We do feel that if you're in a barn, if that's the only place you can conveniently score animals, and you have a window that's letting in full light, you can bring the animals to the window and still get a direct beam of light in order to score them. Sometimes it's very easy as you're restraining the head to shade the eye. You want to be careful not to shade the eye with your body or shade the card as you're looking at it. So it takes a little practice looking around your own particular operation to find the best possible place to score the animals. So Catherine now is going to demonstrate our procedure for exposing the mucous membranes so that you can match them to the card. And the first step is to cover the eye with the skin of the upper eyelid so you can't even see the eyeball. Then push down on the eyeball, pull down on the lower eyelid, and you'll see those mucous membranes pop into view. So this is what we're scoring, that nice, beautiful bed of mucous membranes, and you can see how prominently they stand out. Now, if Catherine did not push down and cover the eyeball and push on the eyeball, what she would show is only the margin of the lower eyelid right here. And that is not what you want to score, because usually that scores paler than the mucous membranes themselves will, that bed of mucous membranes. So once again, cover the eyeball with the skin of the upper eyelid, push down on the eyeball, pull down on the lower eyelid, and reveal the bed of mucous membranes. Now, one other structure that I want to point out to you that's present here is this big white tissue mass that's called the third eyelid, or nictitating membrane. And that is a perfectly normal structure. When it pops into view, you almost feel like maybe you're doing some damage to the animal, but you're not. It's a normal structure that comes up over the eye naturally, and when you release pressure, it'll just go right back into its place. But you don't want to score it, because as you saw there, it was much whiter than the bed of mucous membranes. If you scored that white area, you would think the animal was highly anemic. The other thing you can realize from watching our demonstration here is that animals may fight you as you're trying to perform this procedure. So that's all right, because it's not that you need to stand and study the eye for an extended period. You want to get a quick glimpse of the membranes, make your decision quickly, and then let go. Because as you stand there holding the eye open, holding those membranes exposed to the air, they will in fact get redder. So you want to make a rapid decision. And then you've made your score, you go on to the other eye and just repeat the same process. Again, cover the eyeball, press down on the eyeball, pull down on the lower eyelid, and you'll see the membranes. And this animal is scoring, this sheep is scoring about a 1, and it was a 1 on the other side as well. So if you do both eyes and you find that they're different, which can happen fairly often, you always want to take the score that represents the greatest amount of anemia. So the highest number would be the score that you would use. And that way, if there's any possibility that an animal needs to be dewormed, you're not missing it. We want to make any error on the side of caution. So if we had a 2 here and a 3 here, we would score the animal a 3. Something to keep in mind in performing FAMACHA scoring on your animals, in setting up a place to do it, is how to hold the card so that you can actually match it up to the eye, because you need to refer to the card each time. You shouldn't do a few animals and then say, oh, I know what those colors look like, I don't need the card. You need to refer to the card each time. This is a fairly bulky card, and sometimes if you're scoring animals by yourself, it's a little awkward holding the card and the head and exposing the membranes. So there are several different strategies you could try for making the card easier to manage. You could put a hole in each corner of the card and then make a little apparatus, a little harness with rubber bands, and so strap it to your hand. My hand's a bit small for that. Another thing you could do is just cut off the bottom of the card with the numbers on it, and then that's a smaller piece of material that you need to hold. If you have a place where you're doing this regularly that has a surface that you could mount the card on, you don't want to leave it there all the time, but make a little holder that you could slip the card into while you're actually scoring. Those are all ideas for how to make it easier to manage the card as you're trying to score the animals. We've shown you performing the FAMACHA scoring on a sheep. We're now going to show you the same thing on a goat, and really it doesn't differ. The technique is exactly the same. So again, starting off, you want to be in direct natural light. You restrain the animal by the head, and then with the thumb of one hand, you cover the eyeball with the skin of the upper eyelid. You push down on the eyeball. You pull down the skin of the lower eyelid, and the mucous membranes will pop into place. And you can see on this animal clearly that really doing it correctly, all you can see is that bed of mucous membranes. They're beautiful, and we'll bring the card down here, and that animal would score a 2. Then you turn the head and repeat the process on the other eye. And these membranes again would score 2. Now, one of the peculiarities of goats that we've noticed is that sometimes their mucous membranes look rather mottled. You'll see pale areas and very pink areas. And what you want to do is score the pinkest portion. Don't worry about a patch that might be pale if the remainder of the membranes is nice and pink. Now, we'd also like to demonstrate the FAMACHA scoring on this animal because it represents a slightly different color than the normal membranes we saw a moment ago. So Catherine again is going to expose the membranes with cover, push, pull, and pop. And now you can see these membranes, which are paler overall than they were in the other goat, and we would score this animal a 3. As we described with the sheep, it's important to make your decision quickly because those membranes will continue to get redder as you hold the eye open. So your initial impression is fine, score the animal, score the other eye, and move on. Also, no half numbers. You have to be definite and commit to a whole number. And remember, eyes may differ, so it's important to do both eyes. If there's a difference between eyes, always take the higher number, indicating the greater level of anemia. That way we don't miss treating somebody who perhaps needs to be treated. So as you're performing this technique, remember our catchy little phrase of cover, push, pull, pop. That's the process you're doing in exposing the membranes correctly. Thank you for watching this video. My colleague, Dr. Catherine Peterson, and I hope that you find the information useful. If you would like additional information on this topic, it can be found on URI's Small Ruminant Parasite Control website.